All of these people have a lowered functioning immune system. The best way to prevent this is obviously move away from the drug. Hey everybody, welcome back to the channel. My name is Dr. B. This is Dr. B Addiction Recovery. And the question that has been proposed to me today is Tranq dope, why does it cause skin lesions? I'm going to dissect that to the extent that I can given how much we know about it today. In addition, I have 3 other videos on Tranq dope, and please check those out first. And those sort of lead up to this video, but this video stands on its own as each one of them do. Let's get started. Why does Tranq dope cause skin lesions? Well, let's talk about what we do know and what we don't know. Either way, you're going to see that at the end of this, you're going to come out with some useful information. As far as directly asking the question, why does Tranq dope cause these lesions? We really don't know. But I'm going to argue to you, for you, it doesn't matter. At this time right now, we don't know. In fact, I have gotten a lot of reports and some anecdotal feedback that, you would normally think that if people are using Tranq dope, whether muscling it or intravenously, you would presume that the lesions, the skin lesions, are starting at the site of injection. Some of the reports that I'm getting back, I'm not sure if they're true or not, people are presenting with skin lesions at sites other than when they are injecting the needle. That's interesting. If you have any information on that, please send me an email or put it in the comments below. I'm vigorously, actively investigating as much as I can on this issue, as well as reaching out to providers in some of the East Coast border places where this is very prevalent and they're seeing a lot of these folks. So that's of interest if you are getting the lesions at sites other than injection. Number 2, I'm going to argue that it sort of doesn't matter why you are getting these skin lesions. But first, let me talk about this issue. Once you get to the point of pathological skin necrosis, that's a pathway of an immunological response, defense mechanism, trauma. And what presents is all the same thing. A certain chronic wound could have been elicited or initiated by different mechanisms, for example, Tranq dope. And it might be the same end result as a wound that has come from a burn, a trauma, diabetes at times, not always. My point is this. The immunological response, the physiological response, and the clinical presentation at the end of that cycle all falls in the same category of presentation. Why that's important is that it's all treated in the same way. There's nothing magical to find out why in particular Tranq dope is causing these lesions and these wounds, because A, no one's out there trying to solve out how to make Tranq dope safer so you don't get these wounds. Certainly there's a harm reduction argument that can be made to that point in trying to make the drug safer or using it in a safer way so people have less complications. I get that you might have a harm reduction argument. But in general, we know that the end result is the same clinical and physiological presentation as any of these chronic wounds. And 2, it's not important why in particular, because we know what the end result is, and we're not trying to make, it's not like a hamburger or a lollipop that we're trying to improve on. You shouldn't be doing Tranq dope. Let me add one more part to this. Whatever the detailed immunological mechanism is that's causing these chronic wounds, there's something that needs to be added to that. Whether it's Tranq dope or general drug use, in particular intravenous drug use, even more so, all of these people have a lowered functioning immune system, and have probably, in most situations, much more of a difficult time fighting infections or any other physiological response. Two, they have probably much poorer nutrition than the rest of us, much poorer water intake than the rest of us, much less frequent and initiated necessity. For example, when something's wrong, a person would go to the doctor early on. In these cases, we're talking about a very marginalized population with probably an already debilitated immune system and minimal or lack of or zero access to the necessary resources to maintain health and longevity, in addition to their nutritional status and water intake. So, whatever it is that's causing the wound necrosis, the chronic wounds, the insults, the end stage of the wound is going to always be the same within a spectrum of presentation of chronic wounds, of course. The treatment is going to be the same. In addition, for these folks, you have to stop using Tranq dope. You have to stop using drugs in general. They will have less access to nutrition, to resources, and have much more lower standard of taking care of themselves because of the fact that they are vulnerable, that they are marginalized, that they are suffering from mental health issues, that they are suffering from homelessness. And in front of all that, they're suffering from addiction disorder, right? Substance abuse disorder. So that being said, I don't really focus on or really get all bent out of shape over the issue of what's exactly the mechanism of this stuff that's causing skin necrosis, skin lesions to the varying extent that it is. Because one, the end result is the same. All end results in clinical presentation in this situation are going to be the same. A chronic wound of varying sorts. Two, the best way to prevent this is obviously move away from the drug, but keep in mind these people might be much more susceptible to clinical pathology of the presentation of their skin wound because they're marginalized, they're vulnerable, they have mental health issues, they lack access to resources everyone else does, and they already probably have a lower functioning immune system. And finally, one other thing, sadly, when they do have contact with healthcare, there might be stigma. There might be some biases in treating how they present, in addition to the fact that I've seen a lot of healthcare workers, and I hope that's changing as we move forward in the 21st century. A lot of healthcare workers are resilient or resistant to proper pain management, and something that in any other patient, it would not even be something you think about. Keep that in mind. I hope this gives you some information. I hope this, if not dispels some of the myths, but releases anxiety of needing to know exactly why Tranq dope causes these skin lesions. You need to stop. You need to get the lesion treated. It's the same lesion as one caused by any other issue. And I hope this gives us a little bit of empowerment in the fact that we're dealing with a vulnerable, marginalized population that needs to be treated delicately and receive the same services as everyone else. See you guys next time. Hope this helps, and don't forget to like and subscribe.